Hello viewers, I am Dr. Rahul Reddy, consultant andrologist from ANDROCARE Andrology Institute, Hyderabad. Today we'll be discussing about erectile dysfunction. So most of the males, they have erectile dysfunction, and this video will help them in coming to a proper diagnosis. So always diagnosis is very important in treating these kind of problems. See, just giving Viagra kind of medications may not help in curing the problem. What we have to do is we have to bring these males out of medical treatment. See, when they get confidence is, as long as you are taking your tablet and performing, your confidence will always be on the lower side. So this is not a cure, that is a temporary solution. But what we have to do in treating erectile dysfunction is, in 70% of the males we can actually cure this problem. So always root cause analysis is very important. This chart will help us in root cause analysis. So the first common cause, if you see erectile dysfunction, any patient who has erectile dysfunction, the main causative factors will fall in these four different groups. So one is, which is very common in young males, is psychological ED. Psychological ED means generally they will have good erections, but because of previous failures or abnormal fears or abnormal expectations, they will have psychological ED. That means if they try for first time because of some anxiety or first day they are stressed out, or some couples during their first night already they are tired because of their hectic schedules, they can't perform because of the tiredness. So once there is a failure, they always think about their failure. So next time, normally people when they try for sex, they'll have that excitement, but once there is a failure, that failure will haunt them. Always it sits there. So next time when they try for sex, always this failure, they keep thinking about this previous failure, and which leads to another failure. So this is called psychogenic ED. And apart from this, there are so many performance related doubts sitting in their mind, like size of their organ, ejaculatory dysfunction, how many, and whether their partner will be happy or not. There are so many other doubts which leads to confusion, and they'll have negative thoughts, and which leads to failure, and it settles down as psychological ED. Second common cause is hormonal ED. Now, most of the males have testosterone deficiency, not only testosterone, vitamin D deficiency, all the vegetarians, they will have B12 deficiency and zinc deficiency and hormone deficiency. All these things can cause hormonal erectile dysfunction. So testosterone is the main male hormone. This testosterone, nowadays most of the males, they have this testosterone deficiency because of our lifestyle. So if you see, anyway, I will be making a separate video about testosterone hormone, but common problems what we face is lack of sleep, stress, exercise, lack of exercise, prolonged sitting, obesity, smoking, alcohol. All these things can cause hormonal erectile dysfunction, and this can be totally cured with some medications and lifestyle modification. We can actually treat this, we can cure this. And psychological ED, they need some confidence. So just consultation may not help these patients, because what happens is one medication or two medications may not bring down their anxiety. So they need proper consultation, counseling, and they need doctors' help till they perform successfully. Once or twice they perform normally, they'll be okay. After that, they don't need any treatment. The third group is little difficult group, is vascular ED. So now see, penis is like a balloon. There are two cylinders in the penis. These two cylinders, if they are properly filled with blood, then you get an erection. So now if these two cylinders, normally this is the penis and there are two cylinders, and there is one more urine pipe just below that. If these two cylinders are properly filled with blood, then you get an erection. So the grade of hardness also depends how much of blood is going inside, what is the quality of the blood vessels, whether they are healthy or whether there is any blockage. So this vascular ED depends on this blood supply. but this is little difficult to treat because already if blood vessels are totally damaged, it takes some time. In 70% of them, we can completely bring them out of medical treatment. Probably it takes 4 to 5 months or 3 to 4 months for them to come out of medical treatment. So then they have to maintain their lifestyle. Then that makes them help. That means we can cure them. But in 30% of these patients with vascular AD, they need surgeries or therapies like shockwave therapy. And the last one is neurological, but this is very rare. This is only seen after some spinal cord surgeries or major accidents which includes spinal cord injuries. This is rare. Generally, people with neurological ED, they don't have erections at all. People with vascular ED or hormonal ED, they will have mild erections, but here zero erection. So it is easy to differentiate and it's a rare problem. So now we have only 3 things to identify whether a patient sits in psychological group or hormonal group or vascular group, or sometimes a combination. Once there is hormonal erectile dysfunction, their confidence levels will come down, and again psychological ED can set in. So now we have to analyze where they sit in and we have to treat from there. Okay viewers, in our upcoming videos we will try to explain all these possibilities, how to overcome psychological ED, how to treat naturally this hormonal balance, how to balance hormones naturally, and how to deal with vascular AD, what types of treatments available, how many months, what are the success rates. All these things we will be making videos. Please subscribe to our channel, and if you have any queries, please post in comment section. We can't answer individual questions, but we will be making videos on all your comments, because it's useful for other people who are having similar problem. So keep watching our videos, viewers. Goodbye.